Hello, everybody. This is Gary. Today is February 17th, 2022. It is 5:28 p.m. Eastern Standard Time in the United States and Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, I'm still in a lot of physical pain. My right knee hurts really bad. There's no broken bones or dislocation in my right knee. I went to urgent care yesterday and they did an x-ray, but they want an MRI done on my knee. And I tried calling my primary care doctor today and she wasn't available and she may not be available for me to see tomorrow. So I'm in a lot of pain and I'm not sure when I'm going to get this resolved. There might be some soft tissue damage done to my left knee. The tendons or the cartilage might be damaged. Stuff that would not show up in an x-ray. My knee is bandaged right now. They gave me crutches to walk if I need to use them. So far, I really haven't needed to use them, but still walking is pretty painful. So I'm not sure what's going on with that. As far as my psychiatric symptoms go, my anxiety levels are very high. My paranoia is very high. I was out today. I went to the dentist, and I thought people were following me, talking about me behind my back, spying on me from cars and things like that. So my paranoia was pretty bad today, and it still kind of is. My hallucinations are not that bad. My auditory hallucinations are pretty much at baseline. They're not too intense. I pretty much easily ignore them. I'm still trying to stick to my daily schedule that I do every day, which is including making videos like this one. Having schizophrenia and physical problems together is not easy. About 2 weeks ago, I started on the drug Cymbalta. I forget the generic name for the drug, but it's an antidepressant. And I'm taking it for physical, neurological, muscular, skeletal pain. It may take several weeks before it actually starts to work on my pain. It's not specifically for my right knee pain. That seems to be something different than my other pain. I'm still taking Neurontin for physical pain, Tylenol for joint pain, other pain, muscle pain. I'm still taking Flexeril for muscle spasms and muscle pain. And I'm still taking all my other medications for acid reflux, preventing stomach ulcers, stomach bleeding, that kind of thing. I'm still on high blood pressure medications, which I have to take every day. They took my blood pressure yesterday at the urgent care, and my blood pressure was pretty high. It was like 157 over 94, which is too high. It may just have been because of the stress of my having to go to urgent care in the first place, being in physical pain. And I take Zyprexa and Clonopin when I need to. When my psychosis is bad, I take the Zyprexa. And when my anxiety is bad, I take the Clonopin. I'll probably take both of those tonight, just so I can get to sleep. I did sleep okay, I guess, last night. I could always tell that I had a good night's sleep when I could remember the dreams that I had. So I slept pretty well last night. Hopefully I'll get some good sleep tonight. I've been juggling a lot of different doctor's appointments, physical therapy appointments, dental appointments. I had an appointment every day this week, except for tomorrow. And the week before that, I had medical appointments every single day over the last week. There's a lot going on, and I'm really just trying to juggle all these different appointments. I set up a dental appointment, which I can't keep because I didn't realize I had an appointment this Monday with my physical therapist, which I don't want to miss. Um, and so I'm going to have to reschedule that. Um, I did see the dentist today. They didn't do anything other than look at my teeth. They suggested that one of my teeth on my right bottom side of my mouth should be extracted because I have bone loss in part of my mouth, and that tooth shouldn't really stay there, and it should be extracted. Need a general dental exam and a general dental cleaning, as well as having that tooth extracted. So I'm juggling a lot of different stuff, and this is all very difficult as it is. It's made even more difficult when I'm hallucinating, I'm paranoid, I'm depressed, and my anxiety is really high. Um, so far, I've managed to avoid going to the psychiatric emergency room. The last time I went to the psychiatric emergency room was October 30th of last year, so about 3.5 months ago, which is a new record for me because I was going to the psychiatric emergency room like twice a month. But if I'm not actively suicidal or violent, I try to avoid going to the psychiatric emergency room because, like I've said countless other times, it's chaotic, it's confusing. You can be held there for 2, 3 days before you even get to see a psychiatrist. It's overcrowded, it's noisy, it even gets violent sometimes. Um, there's a lot of people squashed into a very small area on the second floor of the hospital. The psychiatric emergency room at Strong Hospital is above the medical emergency room on the second floor, and it's a locked facility. Once you're in there, you don't leave until you get evaluated by a psychiatrist. And that's why I avoid going there unless I'm in danger or other people are in danger because of me. Um, so I'm neither violent nor suicidal, so I'm not going to the psychiatric emergency room, no matter how crappy I feel right now, and I feel pretty crappy. But that's all the report right now.